If you're over 50, you need to pay attention right now, because there's one pill that millions of seniors take every day, thinking it's harmless, even beneficial, but in reality, it could be quietly weakening your heart and putting you at risk of heart attack or sudden cardiac events. You may have taken it for joint pain, headaches, or even to improve your sleep, but inside your arteries and heart muscles, it starts a silent process that can take years to manifest, and by the time you feel symptoms, serious damage may already be done. I'm speaking to you not as a casual observer, but as a heart surgeon who sees the consequences of this pill every week, and believe me, most people have no idea it's silently harming them. Before I reveal exactly which pill this is, make sure you subscribe because I'll also show you safer alternatives and life-saving tips that could protect your heart immediately and over the long term. Now let's dive into the science behind how this common pill affects the heart, because understanding the mechanism is crucial. Many seniors believe that over-the-counter pain relievers or certain supplements are completely safe, but they interact with your cardiovascular system in ways most people don't realize. When you take this pill, it can subtly increase blood pressure, promote inflammation inside the arteries, and affect the heart muscle's ability to pump efficiently. Imagine your heart like a pump and your arteries like pipes. Over time, repeated exposure to this pill causes tiny damages to the inner lining of your arteries, called the endothelium. These tiny injuries don't hurt, and you don't notice them day to day, but they create sticky areas where cholesterol and fat can accumulate. Combine that with slightly higher blood pressure and small changes in blood thickness, and you have the perfect conditions for plaque buildup and eventual blockage. This is why I often see seniors who have been taking this pill for years, showing up with unexpected heart issues that could have been prevented. The problem gets worse because the pill's effects are cumulative. One dose may do little, but decades of regular use, even at recommended doses, can slowly weaken the heart muscle, reduce its efficiency, and compromise blood flow to vital organs. Many patients report feeling mild fatigue, shortness of breath, or unusual heart palpitations, but they often dismiss these symptoms as normal aging. Meanwhile, their arteries continue to stiffen, their heart muscle becomes slightly weaker with every dose, and the risk of major cardiac events quietly rises. Seniors are particularly vulnerable because aging itself affects circulation, blood pressure, and heart elasticity. When you combine natural aging with the prolonged use of this pill, the results can be dangerous. And the reason this pill remains so popular is because it's marketed as a simple solution to everyday discomfort, without warning labels about long-term cardiac effects that people need to be aware of. The pill I'm talking about is one of the most commonly used over-the-counter medications for pain relief and inflammation. NSAIDs, such as ibuprofen or naproxen, which millions of seniors take daily for arthritis, joint pain, or general aches. While these medications may provide temporary relief, they also come with hidden risks that few people understand, especially for those over 50. When taken regularly, NSAIDs interfere with the production of prostaglandins, which are molecules that help regulate blood flow, protect the lining of your arteries, and maintain healthy kidney function. With this protective mechanism weakened, your arteries become more prone to inflammation and plaque buildup. At the same time, these pills can slightly increase blood pressure, reduce the elasticity of your blood vessels, and even alter the way your heart muscle contracts over time, making it work harder than it should. The combination of these subtle effects is enough to slowly weaken the heart without causing immediate symptoms, which is why it's often called a silent threat. Many seniors notice nothing until they experience palpitations, mild chest discomfort, or fatigue during ordinary activities, signs that are easy to dismiss as part of aging. But inside, their hearts and arteries have been under stress for months or years, quietly deteriorating with each dose. The danger becomes even more significant when these medications are taken alongside other common habits of seniors. like consuming high-sodium diets, having mild dehydration, or combining them with certain supplements or prescription drugs. This combination amplifies the effects, increasing the likelihood of heart attack, stroke, or sudden heart failure. One of the most shocking findings I've seen as a surgeon is that even recommended doses, when taken consistently over years, can lead to measurable cardiac stress, subtle weakening of the heart's pumping capacity, and chronic inflammation that is hard to reverse. And yet, most people continue taking the pill daily because it works immediately for pain, so the long-term consequences are often ignored. That's why education and awareness are crucial, because the solution isn't always to stop all medications, but to make informed choices, reduce unnecessary doses, and adopt safer alternatives that protect your heart while still addressing your pain. Fortunately, there are safer strategies that seniors can adopt to reduce dependency on these pills while supporting heart health. Switching to natural anti-inflammatory foods, such as turmeric, ginger, and omega-3 rich fish, can help manage inflammation without the cardiac risks. Gentle, regular exercise, like walking, swimming, or stretching, strengthens the heart and muscles, reduces joint pain naturally, and improves circulation. Staying hydrated, monitoring blood pressure regularly, and avoiding excessive salt intake also protect the arteries from additional strain. For pain management, topical treatments, heat therapy, or guided physiotherapy can replace or reduce the need for NSAIDs. By making small, consistent changes in lifestyle and using medications more judiciously, seniors can dramatically lower their risk of silent heart damage while still maintaining mobility and comfort. The key takeaway here is awareness, understanding that a seemingly harmless pill taken for years can silently weaken your heart, and that proactive steps, dietary changes, exercise, and safer medication choices can reverse or prevent much of this damage before it becomes life-threatening. Over the years, I've seen countless seniors come into the operating room or the clinic with symptoms that seemed mild at first, a bit of fatigue, occasional shortness of breath, or slightly elevated blood pressure. But upon closer examination, their hearts have already been affected by years of taking these NSAIDs without proper monitoring. Some patients are shocked when I explain that the very pill they trusted to relieve their joint pain is also one of the reasons their arteries have stiffened and their hearts have become weaker. Case studies show that seniors who reduce or eliminate unnecessary NSAID use, while simultaneously improving diet and exercise habits, often see measurable improvements in blood pressure, circulation, and even heart function within months. It's not magic. It's simply giving the heart a chance to heal, removing the silent stressor that has been weakening it over time. Beyond diet and exercise, understanding the interactions of medications, supplements, and everyday habits is vital. For example, combining NSAIDs with certain over-the-counter cold medications or specific blood pressure drugs can amplify the heart risk, while staying hydrated, maintaining a balanced diet, and spacing out medications can help mitigate it. Seniors who adopt these changes not only feel better physically, but also gain peace of mind knowing that they are actively protecting their most vital organ. The most important message I want every senior to take away is that no pill, no matter how common or trusted, is harmless if used indiscriminately over years, and that awareness plus action is the only way to truly safeguard your heart. Before you reach for the bottle tomorrow, consider whether you could replace that dose with a natural anti-inflammatory, a short walk, or even a stretch routine that takes 5 minutes. These small adjustments, when done consistently, can have an enormous impact on your heart health over the long term. Remember, prevention is always more powerful than cure, and your heart has the remarkable ability to recover if you treat it with care. If you found this video helpful, and you want more life-saving tips and hidden truths about health, make sure to subscribe now and turn on notifications. Because every week we uncover the information that your doctors might not tell you, but that can literally save your life. Start today, protect your heart, and make the change that could add years of healthy, vibrant life ahead.